Okay, so I'm Aaron Level. I'm the Vice President of Communications and Public Affairs and the Interim Vice President for Human Resources, and happy to be here moderating today's town hall on November 17th. We've got, as always, a packed agenda today, so we'll get right to it, but a little housekeeping off the top. We will have the Q&A function open, so you can use the Q&A function to post questions. You can write them in there at any time, and the panelists that are here will do their best to answer those. And those answers will stack up in the answer tab, so you can review all of the answers there. We'll keep our chat function free of questions, and we'll use that at the end for celebrations, as is our custom. So as you're partaking of the town hall today, do think of anything that you'd wish to remark on, colleagues, teams, accomplishments that you'd like to shout out, and we'll pause at the end for that to happen. Okay, that's enough from me. I'll pass things over to our President and CEO, Rob McIsaac. Rob, over to you.
Good morning, everybody, and thanks for joining, and thanks, Aaron, for the intro. As is our custom, as we begin, I want to acknowledge that we are privileged to provide care on lands that Indigenous peoples have called home for thousands of years. We recognize and respect the presence and stewardship of all Indigenous peoples as keepers of this land. So as we get started today, I want to acknowledge two very important upcoming observances. The first is Transgender Day. That falls on Sunday, November the 20th, and this observance honors the memory of transgender people whose lives have been lost in acts of anti-transgender violence. I think just as importantly, it's also an opportunity for each of us to reflect on how we can work to help eliminate the discrimination and barriers that transgender people often face. I also wanted to mention on the horizon is the International Day for the Elimination of Violence Against Women. Women around the world are subjected to violence and insecurity every day. Women in our own community are, of course, not immune to this reality. And again, I think all of us have an obligation to speak up against violence against women. If you are a victim of discrimination, violence, or any type of abuse, HHS does have resources that are available to help. You can speak with your leader, visit the hub, where there are plenty of resources available as well. The Human Rights and Inclusion or Employee and Family Assistance Program pages are good places to start if this is a subject matter that's pertinent to you. I should say that if you're tuning in today from McMaster Children's Hospital, I want to say a big thank you. In recent weeks, as anybody who's been following the news knows, pediatric programs have experienced unprecedented demand. This is in large measure driven by the viruses that are circulating throughout our community at the moment. I visited McMaster Children's last week and spent some time speaking with managers and staff. I know the entire MCH team is working so hard and around the clock to manage the surge and to meet the needs of our youngest patients. This most recently has included collaborating with HHS's adult programs to put plans in place to transfer pediatric patients to adult beds should that become necessary. I think we're all hoping that we don't need to lean heavily on that solution, but we are planning, for different possible scenarios. And so in the worst case scenarios, those are some of the things that we're going to have to resort to. I think all told, the HHS community is demonstrating incredible flexibility and teamwork during what are very difficult times. So thank you very much. You can see from the agenda on the page in front of you, we are going to get an operational update. We'll get an epidemiological update, and then we're going to talk a little bit about accreditation. the balance of the agenda, talk about masking, the United Way, and then, as is our custom, we'll finish with celebrations. So I'm going to turn it over to Leslie Gillies, our VP of Community Medicine and Population Health. She is filling in for Sharon Pearson, who's not here today, and is going to be delivering an operational update. So Leslie, over to you.
Thanks very much, Rob. If you could, thank you for advancing. Next slide. So as folks know, certainly COVID continues to be a pressure within our system. Currently, just reflecting the numbers as of midnight, our updated numbers as of midnight tonight. So 103 COVID positive patients, relatively lower number, but greater than 5 within the ICU. And currently we have 2 active outbreaks at Hamilton Health Science. There are 100 staff in self-isolation related to either COVID positivity or monitoring from a symptomatic perspective. So I'll advance the next slide, please. So as you can see, there's extraordinary pressures being felt across all of our sites, and especially as Rob has pointed out, within our pediatric patient populations most recently. And I'll highlight a little more specifically some of the measures that are in place at Mumsy, but also at the supporting adult sites to reduce some of these pressures and to address them. So let's look first at our funded occupancy, running at about 104% overall, so over 100 consistently across all of the Hamilton Health Science sites. ICU occupancy remains between sort of 88 to 90%. And as you can see across the adult acute sites, still very, very high occupancy, with Hamilton General at 107%, West Lincoln running between 110 to 120%. Mumsy, 102% overall, but if you're looking specifically within the medicine, hematology, oncology, and surgical units, as high as 119% occupancy. So that's very high for that site. Of course, Vinci continues to have a high occupancy as well, well over 100 at 112. Currently today, we have 230 ALC patients. So just to continue our many thanks that recognizing both at the adult and pediatric sites, staff and physicians who continue to provide excellent care despite these very high occupancies and significant demands. Very appreciated and very valued. Next slide, please. So as winter approaches, we have a number of strategies to weather the storm, as we say. As you're well aware from previous updates, the Satellite Health Facility has been tremendously supportive in providing care to our patients, our alternate level of care patients. There was 30 additional beds added. So consistently on a daily basis, we have 120 out of those 120 beds filled. And we continue as well to talk with our partners and our peer hospitals regarding strategies and processes to ensure that we have appropriate flow through our Hamilton Health Science sites and the appropriate repatriation as well of patients back to the referring sites so that we can create greater capacity on our units. Surgical capacity remains at 88%. And are certainly a trend of seeing our adult ED volumes remaining at or even above pre-COVID levels. As we're well aware, the pediatric McMaster Children's Hospital volumes in the ED are certainly above pre-COVID volumes. And across both adult and pediatric, we are seeing increasing acuity and length of stay, adding additional pressures. Our unfunded bed capacity continues to exceed 40 to 60. So those are additional beds that are within the system above and beyond our funded beds to support patient care requirements And again, we identified the ALC number, but it does fluctuate sometimes between sort of 225 to 240. Next slide, please. So as we are well aware, the McMaster Children's Hospital is facing extreme capacity pressures. There are many messages that have been updated onto the hub, as well as updates that have been forwarded and shared with both the pediatric and adult sites, so people are up to date on what's happening. There are many discussions and planning underway between the McMaster Children's Hospital and the adult acute sites, especially within the inpatient units. So we have not to date transferred pediatric patient that required surgical or medical care to an acute site, but there are processes and strategies in place in case we had to enact that. And just a further emphasis that this is obviously for older teens. So looking at teens that are 16, 17 and up, there are very, very specific selected pathways and algorithms that would be followed if that need arose for needing to transfer a pediatric patient to an adult site. So it would only apply to suitable patients, and it would be very, very much on a sort of individual patient by patient discussion, and both from ascending and receiving perspective, all necessary plans and supports would be provided. So the staff and the physicians at the adult sites caring for pediatric patients, if that situation arises, will be supported extremely well by their colleagues from the McMaster Hospital, and teams will continue to evaluate and provide support for these services if required. Next slide, please. So as we can see, every aspect of our sector is quite pressured right now. We are continuing to prepare for surge inpatient volumes, both from a pediatric and adult perspective throughout the winter. We're planning and preparing for that. We're looking at many different ways in which we can augment staffing models. There's a number of groups meeting, including Model of Care and our workforce planning group, to see how can we further stabilize staffing to address shortages and to provide much needed support to our teams. So we're looking at ways in which we can supplement current models to hopefully provide some much needed relief as we move forward. Post-acute beds have been expanded. Of course, we've talked about, we're running 40 to 60 on average unfunded beds above and beyond our funded beds. As well, we have, thankfully, the satellite health facility to support with our ALC patient population. Processes have been put in place for continued use of standby and callback for nurses and respiratory therapists on units that are experiencing crisis staffing levels to further supplement and address severe shortages. We have regular incident management system calls or IMS calls corporately. We've been meeting daily this week and previous to, as well as the sites conducting their own site IMS in preparation. There's a new policy that we're working with our Ontario Health West partners to ensure that when patients' care is completed and as required at the Hamilton Health Science sites and patients can return, that those patients are being supported to, in a safe and expedited way, return back to those referring sites so that we can further support much needed capacity at the Hamilton Health Science sites. So again, thank you to all the teams who are caring for some of our most vulnerable people in our community. Truly appreciated, truly valued, and I'll hand off there. Thank you.
Thanks very much, Leslie, for the update today. Lots covered there. Next up on our agenda, we'll have an update on COVID-19 and what's happening across our city and region from Dr. Dominic Mertz, our Medical Director of Infection Prevention and Control. Dominic, what do we need to know?
Yeah, thanks, Aaron. Next slide, please. Yeah, I will briefly talk about COVID-19, but then also touch on the other respiratory viruses, which, as you all know, are troubling us much more, in particular at the Children's Hospital at this point of time. Next slide. From a COVID-19 perspective, these are the provincial data of hospital admissions on the top. Any admissions at the bottom, you see ICUs, and you can see that 3-4 weeks ago, there was probably a first peak in that respiratory virus season, with a slight increase in ICU admissions as well, but currently declining. So good news here. Next slide is our Hamilton specific situation. And you may remember last time I said, it looks like we are lagging 1 week behind the provincial trends. And that's what you see here as well. We peaked 2 weeks ago. And also had 1 week where we had a higher ICU admission rate than in the weeks before and the weeks after. But again, things going into the right direction at this point of time. Next slide. This is the risk assessment by Hamilton Public Health. On the left-hand side, you see COVID-19 cases and weekly incidence decreasing. I would have argued that our number of hospital admissions are decreasing as well. They still said it's stable at that point of time. However, on the right-hand side, you see what we will have to manage in the weeks to come with this flu, which is increasing across the board. Next slide. We don't have updated COVID-19 modelings. This is the model from 2 or 3 weeks ago. I added with the red arrow what actually happened since that model came out. So certainly unexpected that we did see a decrease. We expected that it will slowly increase until we have a faster increase until we peak. Now we came down first. I would still expect that we will see another peak, probably now later in the year, or I have to say in the next year. So rather than a peak end of December, probably that will push it back and probably bring it down. Very curious to see how the next models will look like. Next slide. And we are not any different here in Ontario or in Canada than on the rest in the rest of the world. We often look at Europe because they tend to be one or 2 or more weeks before us with their COVID trends. And you can see these are hospital admissions across multiple countries in Europe, and everyone sees the same. There was like a first peak, not a big peak with COVID-19 admissions. That's coming down at this point pretty much throughout those countries. Next slide. But as I said, let's shift gear and focus on those other viruses. And just to give you an idea, this is the HRLMP report from this week covering data until November 12th. And you can see when we focus on the less than 5-year-old population, there were 9 positive COVID-19s. And then on the next slide, I highlighted all those viruses that we see more frequently than COVID-19. So flu A, positivity rate of 22.8%. So that's already a very high positivity rate and continues to increase. We saw 13 parainfluenzas, 57 RSVs, which looks like it may have peaked now, but this is one of the other main pathogens, obviously, that result in hospital admissions of kids. Still 16 rhinoentero, adenovirus was 7. No flu B in the last week, and no human metapneumovirus. So there's all those other viruses around us at the same time, and in particular in that age group, much more frequently involved in symptoms than COVID would be. Next slide. And this translates into our pressures that we see in healthcare. So this slide, this is from the Kingston area public health unit that have a publicly available surveillance program. The black line shows you the 7-day moving average of new hospital admissions. This excludes, so this graph excludes COVID-19 related hospital admissions. And just focus on the blue line maybe. The blue line is your historical 7-day moving average. And I think there's two pieces that are very obvious. We had much less hospital admissions due to those other respiratory viruses throughout 2022, and I could show you the same for 2021. Pretty much everything was COVID when it came to respiratory viruses. And now we are much higher than we would be expected. Again, expected would be that bluish or turquoise line there. We aren't, when we are looking at the entire population, not any higher than we would be typically in a January when we have the flu peak, but certainly much, much higher than we would typically be in a November, and flu only getting started. Next slide. However, once you look at the patient population where we are struggling most with in the children, that increase is much, much higher than what you've seen in the overall before. So 0 to 4-year-olds at the top, higher than what we would even see at peaks. And that's what translates into that significant strain that we have in the children's hospital. Otherwise, you see a similar trend that we tended to have less hospital admissions due to those non-COVID viruses. And now it's much, much higher than we would have ever expected and would have been used to deal with, I would say. Next slide. I forgot to mention the trend, my apologies. It looks like being carefully optimistic that we may have peaked, in particular in the 5 to 17-year-old range. The black line came down very significantly over the last week. 0 to 4, it still crumbles around peak, but at least it looks like we probably have plateaued for now. Next slide. So those are my summaries. So COVID-19 activity continues to decrease locally and provincially, which isn't what we expected. However, we are probably still expecting another peak during this respiratory season, but later on, probably going into January. New admissions and ED visits for influenza-like illness, so respiratory viruses and pneumonia, seem to have peaked provincially for now, but the decline slowed down or plateaued, in particular in that most susceptible patient population of the 0 to 5-year-olds. Influenza season only getting started. We already have quite a high positivity rate though, but other respiratory viruses have likely peaked. This being said, we do have a vaccine for flu. It's late, but it's still not too late to get vaccinated. So please go out there and get the vaccine if you haven't yet. Children's Hospital remains severely strained with higher than normal respiratory virus activity, primarily due to RSV and influenza. Thank you. Handing over back to you, Aaron.
Okay, thanks very much, Dominic. Great update. So next up, we have our interim VP of Quality and Performance, Tim Dietrich, who's going to talk to us a little bit about accreditation and the cycle that's coming up for 2023. So Tim, over to you.
Thanks very much, Aaron, and hello, everyone. So yeah, I think I would just remind folks what accreditation is, right? It's really an ongoing process, and the dates that you see there is really the external verification, that the care we provide to our patients compared against, the standards of excellence to show that we meet those standards, really to ensure safety of the patients in our system. So a couple of updates that are important for folks. So that's the dates of the surveyors' visits. We are understanding of the ongoing strain on our human resources. And so compared to previous accreditation cycles, we're trying to minimize the administrative burden that goes along with preparing for the on-site visit by the accreditors. So we're going to be taking a flexible approach to preparation, and instead of being prescriptive around how you might prepare for accreditation, it's more about what we might want to do to prepare, and then the how can be best determined in the existing structures within your teams. So you could use any existing committees or meetings you already have to work through the accreditation preparation activities. We encourage you to use the CQI activities that you're already doing, like status sheets, huddles, leadership teams, etc. And then, of course, we'll be preparing the organization for mock tracers to really walk through the patient tracers through your care delivery areas, any existing team communications you might have around newsletters, etc. So again, leaving a more flexible approach. Next slide, please. The accreditation team within Quality Performance has prepared a SharePoint site. All the required organizational practices handbooks are uploaded there. The standard sets for each of the care areas are also uploaded on there. And there are some key activities that have happened over the last little while. Last week, we communicated around the need to identify accreditation leads for each area. And the request for that was to be completed for tomorrow, November 18th. That person's going to function as a bit of a communication hub around sharing information to their teams related to accreditation preparations. Those leads will be invited to an orientation session within the next month to prepare them for their role in accreditation preparations. Yesterday, you would have seen the release of the Patient Safety Culture Survey. This is also an important building block leading up to the accreditation on-site survey. We collect the responses that help us identify where we are at with respect to our patient safety culture, and we use those results to identify areas of opportunity and then improvement plans to help us close some of that gap. Next slide, please. So I encourage you to visit the hub. There is an accreditation site set up there where more information is available. And we have a generic inbox as well for where questions can be forwarded. And lots more information is going to be coming. So this is a very early days in preparation. There's still 10 months to prepare. So you'll start to see communication and activities start to ramp up over the next little while. Thanks very much.
Okay, thanks very much, Tim. I think I have a brief update just to remind people about universal masking across all of our sites. We did, for a moment in time, have a non-mandatory masking policy for our administrative sites at all of our clinical locations, all of our hospital facilities where patient care is provided. We've maintained a mandatory masking policy in keeping with Dominic's update, and given the high prevalence of respiratory virus and illness, and as well the opportunity, I think, to given the Chief Medical Officer of Health's strong recommendation this week around masking, we have gone back to a universal masking policy, so mandatory masking at all HHS locations, including our administrative facilities. So I think pretty clear on that, and I can see already, having been at 2 of those facilities today, that people are embracing that and aware. So if you weren't, now you know. Thanks a lot. Okay, so next up, next slide. We have Sandra Fazzari, who's our Director of Laboratory Operations, to talk to us about United Way. Sandra, over to you.
Thanks, Aaron. Good afternoon, everyone. Well, we are midway through our HHS United Way campaign, and our goal is to raise $90,000. So thank you to everyone so far who have supported this year's campaign. We've had some great prizes to date, and we continue to have a raffle, an ongoing raffle. If you haven't had a chance to donate, there's still time to join your peers and make a difference. You should have all received emails from the United Way with an invitation to give. These emails include directions for making a donation. We have fantastic fundraising events happening right now. There were the recent winners for the Hamilton Tiger Cat tickets and the Maple Leaf tickets have been posted. So congratulations to both those individuals. As I mentioned, we have ongoing weekly raffles. In that, you can win prize packages, and there's some great prizes in there. They're valued, the packages are valued anywhere between $650 to $1,300 each week. So when your name gets drawn, and we will have a draw tomorrow, you are entitled to that full entire package. So please register and buy some tickets for the raffle. We also have an exciting bowl-a-thon back this year that we haven't been able to do during the COVID time. It returns on November 30th. We currently have 14 teams registered. We need 34 teams to meet our fundraising target. So please form a team of 5. Play for great prizes and bragging rights. Your team can include your colleagues, friends, or family. So It's open to any format. So please go online and register for that as well. And as I mentioned, so for more information on how to donate and participate, visit the HHS Hub. And now I want to welcome Meredith Burke from the United Way, who will share a little bit more about this vital campaign and the great fundraising, the reason for the great fundraising that we're doing.
Thank you, Sandra. And it's really such a privilege to be joining you today, this HHS team that's providing first-class care to its patients and this community. Now, I know that United Way and HHS have had a partnership for a very long time, but I'm wondering if you know the story of how United Way came to be. Well, it actually all started back in 1887 in Denver. And there, a woman, a priest, 2 ministers, and a rabbi came together. I know it sounds like the punchline to a joke, but it's true. It really did happen. They came together because they wanted to help the starving during a particularly harsh winter. And they believed there was a better way to meet the needs of local residents. By banding together, they could collect funds for local charities, coordinate relief services, and counsel and refer clients to cooperating agencies. That year, they raised over $21,000 for the greater good and created the movement that would become United Way. And today, when we continue to be stronger when we come together. Great things really do happen when you combine kindness, generosity, and innovation. Next slide. So here we are in 2022 and our communities still need our help. We're on the heels of a pandemic that struck a devastating blow to so many through struggles with mental health, substance issues, social isolation, and domestic violence. And now we're looking at uncertain and turbulent economic times. Many of our neighbors are having to make some really difficult decisions about which bill they can afford to pay, housing costs, utilities, fuel, clothing, and food. And so that's why this year's campaign has never been more important. When you give to United Way, you're funding a network of essential programs like distress lines, mental health counseling, after-school programs, Meals on Wheels programs, and social activities for isolated seniors. Now, like Sandra said, we're halfway through the HHS United Way campaign with a goal to raise $90,000 for the local Hamilton community. But this amount represents so much more than dollars and cents. It represents possibility for real people with real stories, and more often than not, complex ones. So if you've already made a contribution, thank you. This investment in our community will be a lifeline for so many who suddenly find themselves needing help. Next slide. Now, if you haven't had a chance to click on the pledge link that you received through your inbox, there is still time. Every contribution, big or small, really will make an impact. For example, $5 a pay gives a newcomer child access to an after-school program to improve their academics and carve a pathway to post-secondary. $23 a pay gives 5 neighbors with a developmental disability the opportunity to learn essential skills like food preparation so they can gain independence. Or $47 a pay, which is a leadership donation, provides 5 months of check-in calls to someone in a mental health crisis. Now, think of how important that support could be, maybe for someone you know, or for an HHS patient. It certainly was for AJ, and this is AJ here in the picture in the bottom right corner of your screen. AJ struggled with mental health since he was 9 years old. He started to show signs of anxiety and OCD. And by the age of 19, things had really escalated to a crisis situation. He had disputes with his family that led to him leaving home. And then he found himself in the hospital emergency room for 2 days. When he was discharged, he found a crisis house, which not only helped him to find some safe shelter, but he was also connected to a youth worker who helped him to manage his mental health, resettle at home, and connect with a variety of other supports. AJ is now enrolled in college. He's taking film school, and he's also a peer support mentor, helping other youth that are going through the same challenges that he did. And that simply wouldn't have been possible without your local love shown through this campaign. So thank you so much to everyone for your support of the United Way campaign this year.
Okay, thanks very much, Sandra, and Meredith as well. We did have our Q&A function open. We were, I think, questionless throughout the day. We'll leave that open until the end of our program in case anybody has been thinking about a question, but you haven't asked it yet. You can type it up in there, even right up to the last minute, and we'll make sure that if we don't get an answer to you live, that you will get an answer by email. So function will remain open. And as always, after the fact, or for anyone that's watching this in its recorded form, you can send questions to hhsnews@hhsc.ca. That's available on the hub as well. Okay, so now I think we'll move to our celebrations, and this is an opportunity to give a shout out to a person, to a team, to a project, to just general goodness that you've seen in your work at HHS. You can raise your hand and give your shout out live, or you can type it into the chat function and we'll read it out for you. Leslie Gillies, you were prompt to raise a hand. What would you like to celebrate today?
Oh, thanks, Aaron. Just wanted to share, announced yesterday at the McMaster University Division, the Geriatric Medicine 12th Annual Update in Geriatrics Conference. The Canadian Institute of Health Research has named our very own Dr. Alexandra Papiano as the Canadian Research Chair in Geriatric Medicine and Healthy Aging. So congratulations to Dr. Papiano, well-deserved recognition. Thank you.
Nice, that's great. Tim, you had a hand up. What would you like to celebrate today?
Thanks very much, Aaron. I'd like to celebrate our patient experience team and quality of care consultants within the portfolio. I think, everyone's aware how much our volumes have increased for patient care, and with that increased activity also comes increased calls to patient relations and risk issues that need to be handled and dealt with. So those teams are also stretched, beyond their capacity, and yet they remain, professional and kind. And so I'd like to thank them for their contribution to our organization.
Wonderful. Thank you, Tim. That's a great shout out. Bruce, you have a hand up. What would you like to celebrate today?
Thanks very much, Aaron. If I could be so bold, I'd like to do 2 celebrations. First off, folks may or may not be aware that last Thursday we had really the grand opening celebration of the expansion of the McMaster Children's Hospital Gender Diversity Clinic. That expansion was made possible by a $500,000 donation through TD, and it's such a big step in our commitment to EDI across HHS, and in particular to drive better care and better meeting the needs of children and youth who go on into adulthood with their gender diversity and gender identity. And so, really want to celebrate the team that got us here over many, many years. Secondly, want to celebrate at the time it's probably the most challenging in the hospital, certainly from an occupancy and a capacity perspective at McMaster Children's that we've ever had. How that team is rallying and continuing to put patients and families first and supporting each other, but also all of HHS, excuse me, I'm tired, who have really come together to rally to support our teams as I think we all seek to do as we face our individual and collective challenges. So really a massive thank you from me on behalf of all of our teams.
Thanks for that, Bruce, and our thanks to you for your leadership through that as well. I see Susan Fucciarelli has reminded everyone that the Before Operational Stress program is available to all our staff and physicians to help deal with the intense stress that everyone's under. There's a lot of information available on the hub. So if you're not familiar with that, you can check that out and see what it is. From Jordan Kloss, a big shout out to the Drug Information Group at MUMSI, especially Natasha F. and Jackie S. for helping us to navigate all the drug shortages and procurement challenges, acetaminophen drops, ibuprofen suspensions, antibiotics, zinc for TPN, and the list goes on and on. Amazing work. Thanks very much, Jordan, for that one. Okay, I don't see any other hands raised and nothing else coming in on the chat. So why don't we call it there? Rob, I'll turn it over to you for a final reminder.
Okay, just a couple of closing remarks. Thanks as always, everybody, for joining today and for continuing to rise to the extraordinary challenge that our business of healthcare presents to us on a daily basis. Please stay well, everybody, and we'll see each other again for the next town hall in a couple of weeks.